What's up, guys? Dr. Jay Feldman here for another guest episode on Pixorize. Today, we're going to be talking about one of my favorite diseases from medical school, and that's cystic fibrosis. Let's get right into it. There's a lot to talk about today. So cystic fibrosis is an autosomal recessive disorder that manifests as extremely thick mucus secretions in the respiratory and digestive system. The mutation responsible for causing cystic fibrosis is a deletion of phenylalanine at position 508 in the CFTR gene on chromosome 7. That's a mouthful, you gotta remember. Some complications associated with cystic fibrosis include recurrent sinopulmonary infections, pancreatic insufficiency, meconium ileus, and more. There's a lot of material to cover here, so let's get started. Welcome to our lovely school cafeteria. Much to our students' disappointment, we unfortunately find ourselves having to cook up some inedible, indigestible green gluck for lunch. Oh wait, what's happening with the cafeteria lunch workers? It looks like they share the students' sentiments and are also furious about the food quality. Or maybe they're just throwing a fit over the poor working conditions. Well, we'll find out shortly in this video. Anyways, the green gluck splashing everywhere in the food tube is here to help remind you of cystic fibrosis. Cystic fibrosis causes the production of extremely thick, sticky mucus secretions in the respiratory and GI tracts. These abnormal secretions are caused by a genetic mutation in that CFTR gene that causes a defect in the folding of chloride channels. In most tissues, this leads to decreased chloride secretion, which has an osmotic effect that leads to less water in the secretions. Now, this manifests as thick, viscous mucus secretions that plugs up almost every organ system in the human body. Just remember this green gluck to remember the thick mucus seen in cystic fibrosis. Got it? Let's move on. Next, take a look at this food tube over here. It strangely resembles the intestinal ileum, right? It looks like our ileum-shaped food tube is obstructed by a large amount of green gluck. This plugged ileum-shaped tube should help you remember that meconium ileus is classically seen in newborns with cystic fibrosis. Meconium refers to the fecal contents of the baby's bowel, and in cystic fibrosis, it becomes extremely viscous and sticky, which can cause bowel obstruction. Symptoms of meconium ileus include abdominal distension, bilious emesis, and failure to pass meconium in the first few days of life. Now, the point here is to remember that the gut is a tube, and if the tube is blocked at one end, the gastrointestinal contents have to exit the tube at the other end. In other words, in meconium ileus, the newborn ends up vomiting to remove the contents of the GI tract, and the vomit will be bilious because the ileum is distal to where the bile enters the small intestine. Long story short, just remember that meconium ileus is a classic buzzword for cystic fibrosis. Next, let's take a look at the rioting lunch worker's nose clip. I guess he's using this clip to block out the foul stench from the yellow substance which was the primary cause of the lunch worker's horrible working conditions. Now we know why they're rioting. They hate the toxic sludge fumes. This worker's nose clip should help you remind you that cystic fibrosis can cause nasal polyps. Nasal polyps are relatively common in cystic fibrosis patients, affecting 10 to 50% of patients. If a child presents with nasal polyps, you should get a sweat chloride test to assess for cystic fibrosis. Next, notice how this pan has broken and fallen to the floor in the midst of this lunch worker rebellion. In fact, the cafeteria worker dropped the pan in order to throw a tomato at the security officer. This broken pan is our symbol for pancreatic insufficiency. Get it? A broken pan for pancreatic insufficiency? I like it. The pancreatic insufficiency is caused by obstruction of the pancreatic ductules by viscous mucus secretions. This causes digestive enzymes to get plugged up in the pancreas, where they lead to irreversible damage. The resulting inflammation can lead to the formation of cysts and fibrosis, which is where the disease, cystic fibrosis, actually gets its name. Wow. Next, let's take a look at that yucky yellow substance splattered on the lunch worker's backside. When the pancreatic pan fell and broke, its yellow contents splattered all over the man's backside. This image should help you remember that pancreatic insufficiency causes steatorrhea, or fatty stool. As we mentioned, the pancreas normally secretes digestive enzymes, but in cystic fibrosis patients, The digestive enzymes never make it to the intestines. Notably, the pancreas makes pancreatic lipase, which helps break down fats in the intestines so they can be absorbed. A lack of pancreatic lipase leads to the inability to absorb fats, which leads to malabsorption of those fats and steatorrhea seen here. Now, before we move on, I also want to mention that pancreatic enzymes can be given with the aforementioned problems. Most patients with cystic fibrosis will need to take enzyme supplements before they eat, which can help relieve some of their digestive problems. Next, let's discuss another complication that is commonly seen in cystic fibrosis patients: infertility. Take a look at our poor security officer here. He's caught in the middle of the riot and our chief lunch worker is throwing tomatoes at him. And it looks like a tomato has just hit him in the groin. Ouch, that's gotta hurt. This image of the tomato hitting the security officer in the groin should help you remember infertility. Not fun. In male patients, thick secretions in the sperm canal can prevent sperm from exiting the body, therefore explaining the infertility. If this happens during development, patients can even have absence of the vas deferens, which again obviously leads to infertility. In women, thick cervical mucus can make it more difficult for sperm to penetrate the cervix, again leading to infertility. Next, notice how the floor is splattered with tomato juice around the security officer. This poor dude is getting pummeled by these tomatoes, and the floor is being splattered with tomato juice. In fact, the tomato juice kind of looks a bit like blood, yeah? The smashed tomatoes on the floor are a symbol for coagulopathy, which is caused directly by pancreatic insufficiency. Remember how we mentioned that the inability of pancreatic lipase to enter the intestines causes the malabsorption of fat? Well, this lack of fat absorption translates into fat-soluble vitamin deficiencies. The fat-soluble vitamins are A, D, E, and K. I remember them as ADEC. And because vitamin K is deficient in cystic fibrosis, coagulopathy or an inability to clot blood can result from this condition. Makes sense, right? Next, take a look at the police baton or the club that our security officer has suspended from his belt. This club should help you remember that cystic fibrosis can result in clubbing of the nails, which is a nonspecific finding usually linked with pulmonary disorders. Next, notice how so much of this green gluck is being splattered on the kitchen fan, causing the fan to break. This broken fan is here to help you remember that cystic fibrosis can result in recurrent sinopulmonary infections, such as sinus infections and pneumonia. The fan normally blows air, but when it's broken, it's unable to circulate air throughout the lunchroom. The fan's impaired ability to blow air should remind you of infections of the respiratory system. Now let's take a step back to discuss the mechanism by which cystic fibrosis can cause recurrent sinopulmonary infections. This thick mucus plug can cause increased ciliary dysfunction, inflammation, and bacterial colonization. The eventual result is the body's impaired ability to clear these excessive sinus secretions and chronic sinusitis. Similarly, lung infections are caused primarily by obstructions from thick mucus secretions. Mucus plugging of the bronchioles creates ideal conditions for bacterial growth and proliferation within the airways. The inflammatory reaction then further increases mucus production. Thus, a positive feedback loop is maintained with increased mucus secretions and increased inflammation and infection. The final outcome of this cascade is impaired ventilation of the lungs and the airways. So which bacterial organisms cause recurrent sinopulmonary infections in cystic fibrosis patients? Well, take a look at Mona Lisa. She's the chief lunch lady or the queen bee of the cafeteria. By the looks of her golden staff, Mona Lisa runs a really strict cooking operation. In fact, Mona Lisa uses her staff to exert her authority over the lunch workers. I wouldn't be surprised if her tyrannical rule is one of the primary reasons for the lunch riot. Anyway, our Mona Lisa should help you remember Pseudomonas aeruginosa. Get it? Pseudo-Mona? It's the Pseudomonas Lisa. Pseudomonas often colonizes the lungs of CF patients and is a classic infection that you should know about. Next, take a look at Mona Lisa's golden staff. This staff is Mona Lisa's key to power. She uses it to control the lunch workers and rule the cafeteria with an iron grip. And who wouldn't listen to someone carrying around a staff made of solid gold? This golden staff should help you remember Staph aureus. Aureus literally means gold in Latin. Staph aureus infections are also common sinopulmonary infections in CF patients. Got it? Okay, let's move on. Now, let's discuss treatment options for these complications. As we already knew, our lunch workers are in the middle of a chaotic riot. It seems one of our lunch workers is drawing their gang symbol on the wall. But what is it? None other than the Aztec crow, the official emblem of the resistance. Notice that there are two words being used to describe this gang symbol. Aztec, crow. The first word, Aztec, is here to help you remember azithro in the word azithromycin. Aztec for azithro. And the term crow should help you remember that azithromycin is a macrolide. Macrolide. Get it? Azithromycin is an effective antibiotic for cystic fibrosis complications, and this is because it also has anti-inflammatory properties. Just remember our Aztec crow, and you'll be set. Okay, I'm getting worried about getting hit with some of these tomatoes. Whoa, that was a close one. Let's do a quick recap before we get bombarded with tomatoes. So cystic fibrosis is an inherited disorder caused by a mutation in the CFTR chloride channel. Meconium ileus may be seen in newborns and can be the first clue in establishing a CF diagnosis. Patients can also present with recurrent sinopulmonary infections, such as pneumonia and sinusitis. Viscous, sticky mucus plugs can make clearance of pathogenic bacteria very difficult, increasing the risk of infection by bugs like Pseudomonas and Staph aureus. The chronic inflammation may also lead to nasal polyps, a finding which should prompt a sweat chloride test in children immediately. Nail clubbing is also commonly seen in association with all pulmonary issues. Infertility commonly occurs due to blockage or absence of the vas deferens in males, and in females it's caused by thickened cervical mucus. Pancreatic insufficiency can be caused by blockage of the pancreatic ductules. Digestive enzymes can be clogged up in the pancreas, which may result in the cyst and fibrosis for which the disease is named. The lack of pancreatic digestive enzymes also leads to steatorrhea. The pancreatic insufficiency also results in malabsorption of fat-soluble vitamins, notably vitamin K, which can cause coagulopathy. To help aid in digestion, CF patients can take enzyme supplements before eating. Treatment options for cystic fibrosis focus on preventing these complications from developing in the first place. Azithromycin can be used to minimize inflammation, thereby reducing the severity of the complications caused by cystic fibrosis. Well, that wraps up this segment on cystic fibrosis complications. Now, get out of here before you get hit with the tomatoes, and on to the next one. Thank you guys for joining me on this one. Again, my name is Dr. J. Feldman. You probably already see me on Instagram. If not, catch me at Dr. J. Feldman and check out my YouTube channel. Hope to see you guys again. Good luck on your USMLE. Go crush it, guys.